Assalamualaikum guys, this is Saad and welcome back to my channel. This video is about anatomy of humerus, and if you are new to my channel, so please hit the subscribe button to get notification about more interesting and informative videos. So what are you waiting for? Let's go! After watching this video, you will be able to answer these questions. What is humerus? What is its anatomical position? What are its functions? How many articulations does it make and what are they? What are bony landmarks of humerus? And at last, how to differentiate between left and right humerus. Humerus is the longest and largest bone of upper limb. Humerus is also known as urdel. It consists of proximal and distal ends, also known as epiphysis, and a shaft, also known as diaphysis. Anatomically, humerus is located in between the scapula and elbow joint. It extends from shoulder to the elbow. You can say it connects the scapula with the radius and ulna. Its function includes forearm movement, motion transmission, and passage of neurovascular structures along the upper limb. It also serves as an attachment to 13 muscles. It connects shoulder with radius and ulna. Humerus makes two articulations. One proximally, you can say proximal joint, and another distally, you can say distal joint. Proximal joint is also known as glenohumeral joint. It is in between the head of a humerus and glenoid fossa of scapula. The distal joint is also known as elbow joint. Humerus articulates with the head of radius and trochlear notch of ulna. In order to remember the bony landmarks of humerus in a very easy way, you have to divide the humerus in three sections: the proximal region, shaft, and a distal region. Taking start from the proximal region. In this region, the most prominent landmark is head of humerus, which makes glenohumeral joint. There are several other landmarks which include two necks, anatomical neck and surgical neck, two tuberosities, greater one at the lateral side and lesser tuberosity at the medial side. In between is intertubercular sulcus, and at last crust of greater and lesser tuberosity. Keep in mind that surgical neck is more prone to fracture than anatomical neck. Both of these necks are located all around the proximal region of the humerus, as you can see. Intertubercular sulcus is a groove-like structure and separates the greater tuberosity than the lesser tuberosity. The middle region of humerus is known as diaphysis or shaft. It contains two landmarks. Number one is deltoid tuberosity, and number two is radial groove, which give a path to a radial nerve. Moving towards the distal region. On its interior surface, it contains two fossae, coronoid fossa on medial side and radial fossa on lateral side. Below them is a trochlea on medial side and capitulum on lateral side. In between the fossae, there is a condyle of humerus. Lateral surface contains lateral supraepicondylar ridge, and just below this there is a lateral epicondyle. You can also mark capitulum on this side. On posterior surface there is a fossa known as olecranon fossa, in which olecranon process of ulna fits in. The yellow line shows groove for ulnar nerve, located just beside the medial epicondyle. You can also identify these landmarks on this surface. Medial side also contain medial supraepicondylar ridge and medial epicondyle, just like a lateral side. In order to identify the left and right humerus, you have to look for the deep olecranon fossa on the lower distal end. Now rotate the humerus so that the capitulum and trochlea face you. If the capitulum is on the left side of the bone, it is the left humerus. If the capitulum is on the right side of the bone, it is the right humerus.